When measuring someone's blood pressure, you want them to rest for a minimum of 5 minutes. Make sure they haven't had any caffeine or nicotine 30 minutes prior. Blood pressure should be taken with legs and arms uncrossed, feet flat on the ground, arms at heart level, their back supported, and it's taken over their bare arm. Blood pressure is measured using a sphygmometer in units of millimeters per mercury. Using a stethoscope to listen to heart sounds, you want to make sure the ear prongs are facing forward. Choosing the appropriate cuff size is very important to determine an accurate reading. The bladder within the cuff shouldn't encircle at least 80% of the upper arm. The next step you want to do is to make sure you align the artery mark located on the cuff to the patient's brachial artery. Then, making sure the knob is turned all the way to the right on the pump, place the chest piece of the stethoscope into the antecubical space over the brachial artery. Quickly inflate cuff pressure to approximately 180 millimeters of mercury. Release pressure at a rate of 2 to 5 millimeters of mercury per second. You will hear 5 sounds known as the cortical sounds. The first sound is known as the patient's systolic blood pressure. The final sound you hear is known as the subject's diastolic blood pressure. Normal blood pressure is approximately 120 millimeters of mercury for systolic blood pressure and 80 millimeters of mercury for diastolic blood pressure. Levels higher than this are an indication of either prehypertension or hypertension, depending on the range of elevation. Maintaining a normal blood pressure is important as prehypertension is a major risk factor for developing complications such as stroke, heart attack, chronic heart failure, kidney failure, and cardiovascular disease.